The Philippines is a country on the move. Its cities are bustling with growth. But beyond the modern world, a different kind of life exists. And there lies a world untouched by the fast pace of city life.
Not all communities look like this. In this vlog, we will show you one of the problems in the community that is important to pay attention to: the healthcare service in rural areas in the Philippines. As we all know, it is part of our rights to have accessible healthcare services in our community. However, there is still a lack of service given to other Filipinos, particularly those who reside in distant areas from the city. Despite continuous efforts to improve the healthcare system in our country, there are still communities that are lacking when it comes to public hospitals, medical facilities, equipment, and professionals. One of the reasons for this is the lack of budget from the government. In today's time, many Filipinos are suffering from different diseases that are left untreated because they don't have the money. Instead of buying medicine or visiting a hospital, they just use the money that they earn to buy food and other essential things. Another reason was not all communities have their own medical facilities, and getting treatment would take hours to reach the nearest public hospital. Even the number of healthcare providers are not enough to cater all the people in the community who needs medical assistance. And that is a real problem that we need to address. People are suffering. People are dying. But here we are, focusing on the irrelevant issues in our community.
Good thing that the Philippine government is bringing healthcare to the most remote corners of the nation. On Panay Island, a dedicated team from the Department of Health is providing vital medical services to our rural community. Services like immunizations were disrupted.
As one of the first strategic decisions of the Yolanda for the UNICEF was that we should give priority to hard to reach areas. Because through our experience, we know that there are the places that sometimes get neglected when it's coming to humanitarian aid.
The Department of Health, specifically the UNICEF today, improves access to essential health care for mothers and children, especially the most vulnerable ones and those living hard-to-reach areas. Health teams are doing door-to-door to register children under 5 and pregnant and lactating mothers. When the team discovers someone is not fully immunized, they arrange for the necessary vaccination at the local health clinic. One of the team members is midwife Maria Roslyn Baton. She was born nearby and is providing healthcare in the area for more than 20 years. She is among the more than 4 million people displaced by the typhoon, which washed away her home. After the typhoon, they moved into the back room so Batan could provide healthcare to the community where she grew up.
Gusto ko nga makabalik gid diri nga daan sa akon nga lugar kay gusto ko gid nga makita ang sitwasyon sang akon nga pamilya kag bisan mabudlay ang lugar nga makakadto ako diri naghimulat gid ako kag mapadayon ko ang akon pagserbisyo sa akong pumuluyo. Nagsige magyapon ako nga immunization, nag prenatal check up ako, nag immunization ako sa mga bata, nag family planning.
Through their tireless efforts, lives are being improved and healthier future are being built. Your contribution, no matter how small, can make a significant difference in the lives of those in need. Limited access to quality healthcare facilities, a shortage of medical professionals. Governance issues further complicate the situation. Funding for rural healthcare is often inadequate, leaving many clinics understaffed and poorly equipped. But there is hope. Across the Philippines, dedicated individuals are working tirelessly to bridge this healthcare divide. Community health workers, often volunteers from the village themselves, prove vital services and education. Let's work together to bridge the gap in rural healthcare and ensure that every Filipino has the chance to live a long, healthy life.
The Universal Health Care Act was signed into law to ensure individuals and families have access to essential health services without any financial hardships. Today, we celebrate public health successes that have improved Filipinos' quality of life. These milestones also serve as our inspiration to keep working together to find more solutions, have more victories over diseases, and help even more people be healthy and happy. This is for all of us. And for a future with health for all Filipinos.